Hello everyone, I am Dr. Ziyad, MBBS, MD in Health Informatics. I am also specialized in clinical terminology and medical coding. In this tutorial series, I will walk through Model Paper 1 for the AAPC CPC Examination. I will share quick techniques to find answers very easily, along with the detailed explanation to help you to understand the key concepts.
Chapter 17 Anesthesia 4 questions. The questions related to anesthesia will pertain to time reporting, qualifying circumstances, physical status modifiers, anesthesia for surgical, diagnostic, and obstetric services. Question number 1. The time reported for an anesthesia service begins and ends. There are 4 answers. Please pause the video, read the answers, and find the answer.
3, 2, 1.
Okay, the correct answer is the time reported for an anesthesia service begins and ends when the anesthesiologist begins prepping the patient, when the anesthetist is no longer in personal post-operative attendance. According to anesthesia coding conventions, the time reported for an anesthesia service begins when the anesthesiologist begins a pre-operative session, remains throughout the operative session, and ends in the post-operative session when the patient is no longer under the care of an anesthesiologist and can be transferred to post-operative supervision. Question number 2. A healthy 28-year-old male with a closed distal radius fracture received monitored anesthesia care for an orifice of the distal radius. What is the code for the anesthesia service? So there are 4 codes available with anesthesia modifier and HCPCS codes. So please pause the video, take your CPT and HCPCS code books and find the answer.
3, 2, 1.
Okay, here you have to highlight this is a closed distal radius fracture received monitored anesthesia care for an orifice of the distal radius. So when you look at the codes, you can see all 4 codes. That is, first codes are anesthesia codes. You can see all are nearby codes. You can use the elimination method to find the answer with the modifiers. So once you go to the code 1830, that is anesthesia for open or surgical arthroscopic or endoscopic procedures on distal radius, distal ulna, wrist, hand, joints not otherwise specified. So this code is clearly represent the case here. So when you look other code, anesthesia for forearm, wrist or hand cast application. So cast application is the closed method, but here is orifice. Orifice means open reduction and internal fixation. So correct code will be 1830. So you have to remember that when you use anesthesia codes, you have to use the anesthesia modifiers for the physical status of the patient. So when you look at the anesthesia physical status modifiers, P1 is normal healthy patient, P2 is a patient with mild systemic disease, and so on. In this case, the patient is healthy, a healthy 28-year-old. So you can use the code P1, 1830 P1. But you have to remember this anesthesia is the monitored anesthesia. So if it is a monitored anesthesia, you have to use the SPCS modifier as well. When you go to the CPCS modifier, QS is monitored anesthesia care service. So you had to use this modifier also. So the correct answer will be answer C, that is 1830 QS P1. If you encounter this case in a real working scenario, you have to use the CPT alphabetic index. So when you go to the CPT alphabetic index, first you have to go to the anesthesia, then go to the subcategory of forearm. It will lead you to the code 1810 to 820, then 830 to 860. Again, go back to the tabular list and confirm the answer. Again, you have to go to the modifiers in the front cover of the CPT book. There you will find the P1, a normal healthy patient. Also, you have to go to the HCPS modifier in the front cover of the book. You will find the code QS, that is monitored anesthesia care service. So the correct answer will be answer C. Question number 9. A 59-year-old male with a history of basal carcinoma of the parotid gland and recurrent squamous cell carcinoma of the anterior neck undergoes combined surgical excision. The otolaryngologist performs a superficial parotidectomy followed immediately by wide local excision of cutaneous lesion on the anterior neck. The anesthesiologist administers general endotracheal anesthesia, managing a difficult airway due to prior radiation fibrosis and moderate COPD, and carefully titrates vasoactive agents for hemodynamic stability. Which two CPT codes best report the anesthesia services for both salivary gland and neck integumentary procedures? So there are 4 codes available. Please pause the video, type the CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight this is a combined surgical excision, superficial parectoidectomy, followed immediately by wide local excision of cutaneous lesion on the anterior neck. The general endotracheal anesthesia given in the patient with difficult airway due to prior radiation fibrosis and moderate COPD. When you look at the answer, the first code is 0000 and 104. You can go directly to the codes and find the elimination answer. Then you can see the anesthesia modifiers. And the second code is 300, 300 and 104. So all are nearby codes. You can use the elimination method. So let's go to the codes. If you go to the code 0000, that is anesthesia for procedures on salivary gland including biopsy. So first part is superficial parectoidectomy. So that is included in the parotid gland included in the salivary gland. So this code is suitable for the first case. Second case is anesthesia for all procedures on the integumentary system, muscles and nerves of head of neck and posterior trunk, not otherwise specified. So 300 is the surgical procedure done in the neck. So here you can see local excision of cutaneous lesion on the anterior neck. So both codes are suitable. And you have to consider the anesthesia modifier as well because the patient having some diseases. So when you look at the code P3, that is a patient with severe systemic disease, difficult airway due to prior radiation fibrosis and moderate COPD. This code will be suitable. If you look at the code P5, that is a morbid patient who is not expected to survive without operation. But in this case, that is not mentioned. So the correct code will be A, that is 100, P3 and 300. So if you encounter this case in a real working scenario, you have to use the CPT alphabetic index. So when you go to the CPT alphabetic index, first you have to go to the anesthesia. The first case done in the salivary gland. So go to salivary glands, it will lead you to the code 100. Again, go back to the tabular list and confirm the answer. Second case done in the neck. So again, go to the anesthesia, then go to the subcategory of neck. Then it will lead you to the following code. So again, go back to the tabular list and confirm the answer. Also, you have to use the modifier. You have to look at the cover of the CPT code book. There you will find the anesthesia modifier P3, that is patient with severe systemic disease. So the correct answer will be answer A. Question number 4. A 42-year-old female with renal pelvis cancer receives general anesthesia for a laparoscopic left radical nephrectomy. The patient has controlled type 2 diabetes with no other comorbidities. What are the correct CPT and ICD codes for the anesthesia services? So there are 4 answers available. Please pause the video, take your CPT code book and ICD code book, then find the answer.
3, 2, 1.
Okay, here you have to highlight this patient having renal pelvis cancer, receiving general anesthesia for laparoscopic left radical nephrectomy. Also patient having the controlled type 2 diabetes with no other comorbidities. When you look at the codes, the CPT code is 860, 840, 862, 68. So adjacent codes are used here. So you can use the elimination method to find the answer. Also, you can see the modifiers used, then ICD-10 code also adjacent codes. So all cases you can use the elimination method. So let's go to the code. So when you go to the code, 860 is anesthesia for extraperitoneal procedures in lower abdomen, including urinary tract, not otherwise specified. But 862 is renal procedures, including upper 1/3 of ureter or donor nephrectomy. So in case you can see patient having renal pelvis cancer and radical nephrectomy here. So 862 code may be relevant. But 868 is renal transplant recipient. So this is not the renal transplant case. This is nephrectomy, removing of the kidney. So the correct code will be 862. The anesthesia codes need physical status modifier. So in this case, the patient is not healthy, but having type 2 diabetes is controlled. So you can use the modifier P2, that is a patient with mild systemic disease. So in this case, you can finalize answer C, that is 862 with P2. So no other answers having like that. So you can finalize this one. So when you finalize this one, you can go back to the ICD-10 and you can look at these 2 codes. So when you look at the code C65.2, that is malignant neoplasm of left renal pelvis. You can see the renal pelvis cancer, that is left. So that is correct code. and E119 is type 2 diabetes mellitus with those complications. So all the codes are suitable for the answer C. So if you encounter this case in a real working scenario, you have to use the CPT index, ICD-10 CM index. So let's go there. So when you look at the CPT index, you have to go to the anesthesia, then go to the subcategory of nephrectomy. It will lead you to the code 862. Then you have to go to the ICD 10 cm. There you have to go to the neoplasm table. So neoplasm table in the initial parts of the ICD 10 cm book. There you have to go to the neoplasm. They are neoplastic. Then you can go to the subcategory of renal, pelvis, malignant. It is a primary cancer, so you can go to the first column of primary cancer, that is referring to you to the C65. Then for the diabetes, you can go to the index of diabetes. There you can go to the type 2 referring to E119. Then you have to add the anesthesia modifier as well, as we done in the earlier, that is P2, a patient with mild systemic disease. So the correct answer will be answer C.
So if you are preparing for the AAPC CPC examination, my channel will help you to solve the problems you are facing in your examination preparation. So please subscribe my channel. And if you have any doubts or any questions, you can put in the comment section, or else you can email me, or you can WhatsApp me to the email and the WhatsApp number displayed here. So please subscribe my channel and stay with me. Thank you.